again, I'd love to introduce, very privileged to introduce Dr. Christopher White. He received his PhD from Kansas. He is a professor of U.S. Latin American relations history. He teaches courses on the war on drugs, the developing world, and the modern world. He is the author of 4 books, the co-editor of one, and is currently co-editing another. And just recently, he was named a Drinko Distinguished Fellow. He's the 30th one to be named. So congratulations, that's an honor. Very good.
All right. Hi, everybody. I'm really happy to be here. And I think that, especially with this audience, I can actually speak about things that you'll understand a lot more than my younger students do, because you've seen the changes over a longer period of time, and you can understand the historical context, things like vaccines. Obviously, I'm sure many of you went through the polio crusade, right? But also, especially in the 1960s and 70s, that's when we started to really turn the curve on big things like measles and smallpox, not just in the United States, but on a global stage too. And so I say all that because as someone, I'm 51, just turned 51 a couple weeks ago. And when the COVID epidemic started out, then as a historian of 15 years or so, I thought I understood global history, trends, and things like that. But I was shocked by COVID, as many people were. And I had to kind of take a beat after a couple of weeks of being at home with my family and not being sure what the future was going to hold. I kind of had to stop and say, wait a minute, just look to history and you'll be able to see how people have handled this in the past. And so I found that history was really important for understanding how to maybe at least give myself some perspective. There's been smallpox epidemics, there's been diphtheria, things like that. And then I started to look into public health research too, and public health experts combined with the historians. I just realized that this is a whole other fascinating field that I hadn't experienced enough. And so I found out how naive I was. In fact, my son, who was in 8th grade at the time, he had been learning about COVID. And I said, well, based on my experiences with SARS and with the swine flu and Ebola, which were the big ones that I heard about, then it's possible that COVID might not even come to West Virginia, because we were the last state to have a positive case, if you all remember that. And my son, who was 13 years old, said, Dad, COVID's going to be in Barbersville. And that hit me. I was like, well, I'm really naive about this. And I was glad. I love finding moments like that where I realize how naive I am, because that means there's so much more to learn. So that's just kind of a preface into what led me to write the book, because I found solace in reading as much as I could. And I went to the state archives in West Virginia. You actually have some records in your hands of some of the state archives I found, but also from a little special collection in the Salt Rock Public Library. If you have lists of death records, I think just a few of you over here have some death records from Wyoming County in the 1870s, I would say. When I started to look at that in March and April of 2020, it just gave me perspective that people have been through epidemics before, and that humanity has the ability to solve this problem as well. So I tend to be kind of, I swing between optimism and pessimism, as I think most people do. But I think with more knowledge, then I can become more optimistic. And that's kind of what my goal is. I mean, I want to be fact-based too, but I also want to have a good view of the future. So March 2020, 1 week before the lockdowns, I was waiting on my son, who was practicing basketball across the street at Salt Rock Elementary School. And I looked into the special collections, and they had all these death records that a woman a few decades ago compiled over the course of 4 decades worth of death records. She found in one case in the 1870s, there were over 70 kids in Wyoming County that died of diphtheria. And you can see some of the records there. They have, what really struck me was the families that were listed. It wouldn't just say this kid, this person at this age died, but it would list sometimes 3 or 4 kids in the same family that had died in 1 week. And then it would list all their parents' names, their grandparents, their aunts and uncles. I only brought a few samples here because I wanted to bring up variety. And it just hit me so hard. I mean, actually kind of moved me to, I got a little choked up thinking about what those families had gone through.
What years did you say that was?
The 1870s, yeah, if my memory is correct. It might say at the top of that one.
76.
76, yeah.
And 1878.
78, yeah. And then some from the state archives go back to the 1870s and 1880s, and I found at the state archives, Joe Geiger, who now works here, he was the head of the state archives at the time. He said, "Oh yeah, come on down, no problem. We're not on lockdown. Just got to wear a mask." And I went down there, and he just brought out all these carts full of records for me. And lo and behold, the state of West Virginia really was a pioneer in public health. Starting back in the 1880s, shortly after the state was founded, they had a robust public health administration where they were in contact with all of the counties in the state whenever anything had gone wrong, whenever they had cholera outbreak, typhoid outbreaks. They had all these protocols too, smallpox outbreaks, and they were literally sending out notices to all the people in the counties where suspected smallpox people were, because there was all kinds of migration, internal migration, because of the railroads were facilitating the movement of workers, right? This is over the course of a long period of time between the 1880s and the 19 teens. And they'd say, there's this person who is from this state who we know he has smallpox. Make sure you stop him. Don't let him get on this train. He's trying to get a job at this place. And they had all kinds of protocols for people who were involved in prostitution to just, they were literally helping people to not spread these diseases. And this is over a century ago, which struck me as interesting because in 2020, we were finding it controversial to implement those types of measures, right? It was seen as political. Anyway, those kinds of examples kind of accumulated. And so I started to realize, well, somebody needs to write a book about maybe West Virginia epidemics, maybe Appalachian epidemics in general, maybe Central Appalachia. I didn't know how to define it exactly, but I wanted to be involved in it somehow. So I got in touch with my colleague, Kevin Barksdale, who's the specialist on Appalachian history. He doesn't know much about epidemics, and he wasn't as much interested in it as I was. And he said, well, I'll team up with you and we'll put together a book, and I can show you how to get in touch with authors and all that. So we did that relatively quickly, got in touch with a bunch of authors from a ton of different disciplines and people who'd already written about epidemics in Appalachia, but we wanted original research. They're already established in their fields. And that's what led to this book here, which finally came out with University of Kentucky Press. And so this is a compilation. I can pass this around too, so you all can look at it. This is just a compilation of research chapters about different epidemics that have taken place in Appalachia throughout history. And this is Appalachia broadly defined. The 420 counties that are included in the Appalachian Regional Commission is what we include. So that actually technically includes like northern Alabama and Mississippi and Georgia, and then goes up to literally up to upstate New York too. But the bulk were certainly in the central Appalachian region. Yeah, so many states, 11 states are included in there. Just a couple of things that I wanted to get to kind of explain kind of the motivations a little bit more too. A ton of these slides, I don't need to go through all of them, but I want to show you just a few. Is that about 10 months into the epidemic, we've already got the contract, we've got the authors that we want, but there is a spike at least in recorded COVID transmission, COVID infection in the state of West Virginia. And this coincides with the rollout of the vaccine in January of 2021. And I was following these numbers on a daily basis and sometimes even hourly basis. And I found that it was really interesting that West Virginia was known as having the best rollout of the vaccine, if you all remember, especially because of the way that the county-based pharmacies are set up, that everybody's local. And so if you have a list of people who want the vaccine, then it's very possible that if a person doesn't show up, that the person who's in charge of the rollout, she knows the person who's next in line personally. That's how actually I got my vaccine too. I wasn't slated to get it for 2 more weeks, but then the person in charge of it here noticed that a person was missing, and so she just called me up, and then I left the gym and drove straight here. And that's how it helped to roll it out. But the problem was that West Virginia was experiencing the highest transmission rate that month. So it was interesting. There were these two different odds. One, on the one hand, great on the vaccines. We're getting attention at the national level, CNN, Washington Post. And the other hand, we had the highest transmission rate, at least according to the CDC. And so I called all the newspapers and radio stations that I could, or television stations that is, and I asked them, is anybody going to do something about this? And Nobody called me back, except for one, WSAZ. They said, hey, what's this thing you're talking about? What do you mean? I said, well, if you look at the numbers, there's this contrast, and I think somebody needs to be covering it. And they said, well, how about if you cover it? Which is not my intention at all. So they said, well, we'll come and interview you for 5 or 10 minutes. And so before I went on, I said, okay, I've really got to bone up on current events even more so. So I was putting together this book, but in tandem with it, I decided that I was going to start a podcast. So I got interviewed on the 12th, and I decided to release my first episode on the 12th right before I went on, just to kind of, put a little bit of skin in the game too, because I was writing and researching and editing about history, but I wanted to have some type of current events experience too. And so I did 48 episodes with physicians, nurses, historians. I interviewed even some students just to try and see what their experience was like in West Virginia, especially in the Huntington area, dealing with COVID. And I kind of considered it to be like a public service thing. And that's really how I see my role as a historian too. It's more about public service history rather than just being fascinated with history, trying to connect history to the present day. And so by doing that, I was actually, it encouraged me to learn more. Obviously, I was going to interview them, so I had to read their books. But I also was just trying to kind of promote more awareness, really wherever the data led to. And in some cases, people had controversial political perspectives, and I was happy to air those too, and to interview them about that. Any questions so far? Yeah, please.
You made a comment about trying to get the vaccine. There were a few from my husband's employment that drove from Huntington to Fayetteville to get the vaccine early on, just like you did, trying to find one. Yeah.
That's right.
Yep.
Yeah, because I know a lot of us were desperate to get it.
Well, one of those daughter at the time is a physician. She was working in Fayetteville. So they kind of had it in, but they did. For about 2 or 3 couples drove to Fayetteville, up and back just to.
And I know in West Virginia, it was a lot more convenient. At Marshall, students and faculty and staff were given the opportunity to get it in this building.
They made it easy for us.
Yeah, exactly. I got mine 2 or 3 months before my family in California got theirs. That, the way, how they had it set up in California, because they were on a much bigger lockdown for a much longer period of time. They had to get into cars in big open lots, and they'd have to drive up, and someone would give them a shot, either through the window or something like that. But they were trying, I think maybe a little bit too excessive in their separations. They didn't open up until like a year after we did too. So those kinds of documents that you have there, these are documents that I used to really kind of get interested before I actually was involved in the book, because I found out that there was a lot of meat out there to work with, to chew on in terms of the primary source documents. Now, a couple of you, maybe 3 or 4 of you, actually have documents that are prescription pads. Who's got a prescription pad? You tell? I think you do. I think you two do.
Is that what this is?
Those are copies of prescription pads. Yeah, that's right.
Oh, I couldn't tell what they were because they had a lot of different people on
And then one of them has a picture of a man on a horse. You got that one, right? So that's his prescription pad. There was a.
Oh,
So,
the person's name.
that's right.
Got it.
The interesting thing about that is there's a collection of this doctor. There's actually a whole collection, a big one that was on one tray, or one tray that Joe Geyer gave me, and it was decades worth of records from this one doctor. And it's hard to read his script, but basically, can you tell any of the things that he's prescribing?
14 tablets of something.
Yeah.
14.
I don't know what that
It
word.
looks like
Oh, it's
atropine and
aspirin.
Atropine
It's
and sulfa.
aspirin.
What's that?
Atropine and sulfa.
Yep, atropine sulfa.
that-
Yeah, that's a type of antibiotic.
This
And
one
then-
keeps showing up on
Is that
every one of
morphine?
mine. That word.
Yep, morphine. That's right, morphine. And then this one is opium.
Opium
Yep,
and
opium grains.
acetate,
They didn't have
something,
That's
lead,
right.
something
What was the
acetate.
years of the?
He was
This
between
is
1919 and the 1960s.
Uh-huh.
Yeah, he was a country doctor, actually. And one of his relatives wrote a little biography of him too, which is included in the records. But also what was included in the records was his requests from the federal government. He had to pay for 3 different types of stamps One was for an opium, to license to sell opium, to prescribe opium, that is, or opium-based products. The other one was a license to prescribe cannabis, marijuana, that is, it actually was called, it's a marijuana stamp is what they called it. And the other one was for coca-based products, meaning that he prescribed cocaine too. And so somebody else here has a list, actually I'll show you, yeah, what I gave Elizabeth, is a list that I oftentimes show my classes, and this is, I have 300 and some odd pages of this, but basically these are the lists of drugs that have been found in the overdose victims in West Virginia for the past 2 decades. So there's a link that people have pointed out before, but it hasn't been emphasized enough, and which is that really most of the drugs that kill people were invented in the 19th century in order to treat the symptoms of the types of diseases that you see in your documents there. So the drug epidemic that we have right now, for cocaine, for example, that was based on, basically they prescribed that to little kids for mouth infections and throat infections too. It's a numbing agent is what cocaine is really. That's what it was invented for. And then with morphine and heroin and opium, those were the catch-all drug. Stop diarrhea for dysentery and cholera, treat a fever, make people rest, stop cough also. All those things are associated, influenza, cholera, smallpox, measles, diphtheria. So it's one of those it's kind of a sad thing that the medical industry brought this medicine on us, but really they were doing it to treat the horrible infections that our ancestors were suffering from in the 19th century.
Were they aware of the addictiveness of the drugs at that time, do you know?
The record is sparse on that. What we do know is, okay, it depends on when we're talking about. Well, let's go back. Even before they synthesized opium and coca into morphine and cocaine, Europeans, whenever they encountered these drugs that were being used by non-Europeans, they had statements about them, usually Christian-based laws, where they said this was something that wasn't Christian to do. So they definitely had an idea that they could abuse them, although they didn't use the word addiction until the 20th
I would
century.
think a small child, baby, would be really strong compared to that body. I don't think.
Well, yeah, because they would actually prescribe cocaine toothache drops, and there's actually pictures of them, of a little baby there, and then the mother is putting either cocaine or heroin. Actually, they would give them.
Well, I remember doctors prescribing paregoric,
Paregoric, which had
opium or morphine or whatever,
And you'd rub it on the
yeah,
babies.
yeah, or for stomach ache. It was for stomach ache because it relaxed.
Coca-Cola.
Absolutely.
And Coca-Cola originally had cocaine.
Symptoms, not the underlying cause.
Right. Yeah, that's a good point.
They're just treating the outlying symptoms.
Right.
Yeah. And the reason why the symptoms were the timeline of that is important because before they came up with germ theory of disease, which is in the second half of the 19th century, then for millennia, people all over the world were using things like alcohol and coca leaves, cannabis, and opium to treat the symptoms. And in a way, the symptoms being treated actually can actually treat the spread of the disease too, because if you are, for lack of a better word, if you're knocked out on heroin in bed because you're trying to treat cholera, then you're not out actually infecting people as much too. And actually it could stop the diarrhea. I'm not trying to promote drug use, obviously. It's more about understanding why our great-great-great-grandparents might have actually been willing to use it, even if they knew it could lead to an infection. I always like to say too, if you've got a baby who is dying of diphtheria, you guys know what diphtheria looked like by chance? Yeah, it's good. It's funny too, because when I show these documents to my classes, 18, 19-year-olds, I'll say, who knows what diphtheria is? No one ever raises their hand. And I say, isn't that wonderful? Because with the vaccine, and diphtheria was the first widely spread vaccine that was used in the country, even before smallpox. Smallpox was done in dribs and drabs locally in places like George Washington's army, that kind of a thing. But diphtheria was a massive campaign because it killed kids. What it did was it created a gray film around the esophagus and in the throat, and to the point where you became suffocated. And if it didn't suffocate a person, there was a toxin in there that the diphtheria bacteria could release into the bloodstream and kill the person. And so little kids were dying of this all the time, which led to the need for, it was worse than measles in that sense. Measles has I I think it has like a 5 to 10%, no, 10% fatality rate, but diphtheria was much higher. And you suffered tremendously for it. And so it makes sense to me that parents would give their kids anything, even if it led to an addiction afterwards, which wasn't really that much of a thing. Kids didn't really get addicted to drugs too much once they were off it. It's like a cancer patient too. A cancer patient that's going to be given fentanyl is very unlikely to be addicted to fentanyl afterwards. People who are addicted to fentanyl oftentimes are people who score it on the street, anyway, that's a whole other matter. But I think that they're very much related. We're dealing with the drug abuse problem right now. We have been for decades in Appalachia, but I see the beginnings of the drug abuse epidemic going back to the epidemics in the 19th century, as opposed to the proximate factors that are happening right now. Purdue Pharma, obviously, that's a company that inflicted OxyContin on the community and the whole country. But the invention of those drugs a long time ago, that's not something we can undo. It's already, it's out in the open right there. And so that's something we have to watch for as well, because with something like COVID actually led to a massive increase in the use of opioids in hospitals, as well as sedatives, benzodiazepines too. But was there an increase in addiction afterwards? That's something that I haven't seen before. That is addiction related to those patients. We don't know that at all. But it's because when they had to intubate people, they had to put them on cough suppressants, which opioids are, and they also had to sedate them with various kinds of drugs in order to keep them calm, because people panic when they have something down a tube down their esophagus like that. Yeah. So this became the most fascinating thing I've ever studied, and this is my favorite book that I ever put together. Even though I didn't write the whole thing myself, I wrote the introduction and then edited it with a colleague. I find this topic to be the most fascinating one that I've ever studied. A couple of interesting things too that I wanted to share with you all. I was teaching a class on the history of global pandemics, and Pamela and Charlie Bowen were in that class. It was 4 years ago, 2021. And one of the students took the initiative to try and do a grave tour of Spring Hill Cemetery with all of the Huntingtonians that were buried there that died in the Spanish flu. And one of the things that she found actually was that the mayor of Huntington died in the Spanish flu too. And a week after he instituted lockdowns, he died. He was 41 years old, and that was pretty common. People who died mainly were in their 20s and 30s. It wasn't young and older people. It was the kind of young adults until middle age. And so she took us on a walking tour of 18 graves that were in Huntington. I'm sure a lot of people who died in Huntington, they just weren't buried there, or she just couldn't find the information. But it was fascinating to see the diversity of people that were there. And I can go through some of these epidemics if you want. I've got all the different chapters here, but we can also discuss any questions you all have so far. Oh, one of the things I should point out too, in the process of actually writing the book, we got 18 authors approximately. Some of them were co-authored, some of them actually had 3 authors in one chapter. Like in East Tennessee State, we got 3 authors in one. And but most of them were single authors. And then we had to cut 5 of the chapters. And so that's part of the process, because we had people who were in criminology and in public health and history and anthropology and medicine and law. And in some cases, the writing just didn't turn out very well. We had a great, wonderful story about an epidemic that took place in central West Virginia. And I'm not being specific because I don't want you to know who the author was, but we ended up having to reject the author because it just didn't, the writing just didn't come together too well. And that was my favorite chapter too. And so it was because it combined perceptions about disease and actual disease too, and it involved immigration too. And so it was just a kind of a revelation about how West Virginia fit into the broader global scheme of epidemics and economics. But the ones that we kept were very solid. In some cases, we had to work more with some professors than others. Like in this case, the first chapter was written by the world's foremost expert on indigenous peoples and diseases, and his name is Paul Kelton. And so we didn't have to work with him at all. He wrote his chapter. It was perfect from the very beginning. And it was one of those things like, nah, I'd like to find something wrong with this so we can improve it, but we'd only make it worse. And he, what was so original about his perspective is that he points out how we way too often focus on the germ aspect of diseases. And I think you all can relate to this too, because if we're just looking at the biological factor of one little microorganism, then what are you leaving out? What are some of the things you might be leaving out?
Social aspect of that.
Right, the behavior of the people, the environment that they're in, what else? That might cover everything, right?
Well, economics,
Sure,
shuts, like how we went through COVID.
yeah.
Shuts everything down.
Yeah, people who live in rural counties in West Virginia that are hours away from a good hospital are gonna be less inclined to go get the vaccine. They're not gonna have, I mean, how are they gonna leave their family behind too? And that has to do with access to money as well, oftentimes. You know, if a storm hits, if there's a flooding in a town, for example, that could exacerbate a disease, not necessarily COVID, but that usually ends up exacerbating things like mosquito-borne illnesses and fecal-borne illnesses too, which are in water. And so those factors definitely matter. He points out how, yeah, the indigenous peoples, the Cherokee and the Choctaw, they died from smallpox and measles and cholera on the Trail of Tears, but it wasn't because, just because of the germs. He said the germs are out there everywhere. They're already there. But when you pack people into a small area, when you don't give them food and water and shelter, when you don't have the means to wash your hands, when you know, all of that. I like to say in my classes, if we all just cram together into the smallest space possible, within a very short period of time, we would start dying. Our germs would interact with each other. We wouldn't be able, if we couldn't wash our hands, for example, anybody, that would happen to them. What happens with Indians, though, of course, is that they are dying from the diseases, and then people start to blame them and say, well, they didn't die from the Trail of Tears, right? They died from these diseases. You know, of course, apologists for the Holocaust say the same kind of thing. Well, they weren't all exterminated. They died from diseases. That's true, but they were also forced into them. Most people were actually murdered, but tons of people died from typhus in particular and typhoid because they were crammed into these conditions. So the germs have to be understood as being everywhere anyway.
Isn't there, and it seems like I read it, it might have been the Atlantic, that there's the debate now in relation to germ theory and this environmental, there's a name for that.
They call it, what I understand is they call it One Health. Yeah, which basically is just looking at the kind of the whole ecosystem. Yeah, there's actually oh, go ahead, sorry.
Well, they have said that they knew that 6 feet away was like just an arbitrary thing that somebody came up with, which was ridiculous because the air moves, you know, constantly. So that was ridiculous. But I was an ICU nurse during all this rigmarole, and people in isolating everybody so completely like they did, I think, in my opinion, it made it worse because you get micro contact with germs all the time. But when you completely isolate somebody and then you have somebody that might be a little bit older or sick, when they come in contact with it because they haven't had those micro exposures, boom, that's, you know, so in isolating people is not always the best way to do things.
Yeah, and it's I completely agree. I mean, the micro exposure is kind of what we do with vaccines too, where we're trying to give them just enough, and it's not necessarily the exact virus itself. Sometimes it's it's like a killed virus, for example, or an attenuated one, like polio. Yeah, I tend to agree now. And also, but there's actually an interesting book I'm in the process of reading called An Abundance of Caution. And it's really talking about how we overdid it during that time. And he starts off by talking about how arbitrary a lot of these decisions were, the 6 feet and the masking and all that.
The repercussions are gonna be felt for years. The repercussions from that are gonna be felt, like with little kids, like their speech, young children, that their standard is, instead of like, I don't know, 25 words by a certain age, they've lowered that because children learn by looking at you, but they couldn't see people because they had a mask.
Yeah, I think that's very true.
Interestingly enough, my daughter was in grade and I was in school, and her school when schools did not open back up, her school was allowed, it was private, was allowed to open back up under a critical care license for daycare. And students on a student support plan, she's dyslexic, and so she had a plan, were able to go to school. So they did the masking, but she never got COVID. And we didn't get COVID. She gets some immunities like you're talking about because she wasn't isolated for as long a time as other
Well, they knew
students.
children weren't gonna be impacted as bad.
Right. She went back to school in September. The others, I don't think went back till first of the
March or April,
year.
after the,
Yeah.
yeah.
So in your look at public health, juxtaposing that, I mean, what's unfortunate is I served for 4 years on the Coalition for Physician Accountability, and my term happened to be during COVID. So you can imagine that coalition, that board was really struggling about all of the misinformation that got taken because people were trying to, in public health, figure it out. I mean, and I think that's the broader ramification, other than what specifically happens to people.
Well, I think a lot of times common sense should prevail over extremes sometimes. People went crazy right out the gate and shut everything down and made it worse. I mean,
It was scary.
I don't wanna get out of
Yeah,
your
no,
discussion, but in my opinion, COVID was here way before it hit the national. We had people in ICU that were so sick and nobody knew what was wrong with them.
Yeah.
Nobody knew. So if it was in
Right.
Huntington, West Virginia, I guarantee it was all over the place for months before that.
Oh, yeah, sure.
And then what
So
happened?
may I, everybody, the nature of this virus, its changeability, its multiplicity of symptoms, that confuse people. How this virus came about, you're going to address that some today, that might be the problem too, that it kept changing and you have to keep getting another shot. Polio was rather obvious.
Yeah.
You knew what the symptoms were. Diphtheria was rather obvious. It didn't change on a yearly basis, I don't believe.
Yeah, actually.
This virus, its changeability resulted in confusion in how to respond to it.
I'm glad you brought that up, actually, because there is there's been a lot written about kind of the broad history of diseases, bacterial and viral diseases, and then you've got mosquito-borne illnesses, which are in another category because malaria, protozoa, and those are related to algae. But basically, we're talking about viruses and bacteria, and the bacterial infections don't tend to have as much variation because those are DNA infections, whereas we have the viral ones, which are a combination of, there's some that are DNA based and other that are RNA based. The RNA based ones are constantly evolving. Influenza is the most classic case because it's just evolving constantly, and they can't really come up with a vaccine on an annual basis or a seasonal basis that's going to be anywhere close to what the polio vaccine was. And so I think that's part of the problem, is that we hadn't been exposed to a variety of diseases in a long time. At least the people who were my age and younger hadn't been. And then of course we hadn't had a really big one nationwide or worldwide since really the Spanish flu. And every single virus is very different from each other. So take SARS, for example. SARS was the case I always thought about. That was 2002 to 3, and had about 800 people that died, 10% case fatality rate, which was colossal. And in that case, you had, that's on the order of measles, for example, and very infectious too. In that case, it spiked and then it just died off. And kind of like with Ebola. Ebola was similar. It went up for about a year and then it ripped through the population and then it dropped off, which is typical for the ones with the high case fatality rate. So the ones with the high case fatality rate that are really quick, they scare people, but then they go away. And then people log that in their memory and say, well, that tells me how other viruses will behave, but they're wrong. But because then when COVID comes along, then you hear about the horrible cases, but there's no way of knowing what the actual case fatality rate is. And there's no way of knowing what the infection rate is. And it mutated very quickly. And we hadn't seen one, I don't know, in my lifetime, I'd never seen anything that had mutated so quickly. But that didn't mean that it was an anomaly, because every virus is different. Influenza, that one mutates very quickly, but it doesn't infect people on a global scale by the millions. Usually, sometimes it does. In Asia, it did. There were some really bad pandemics in Asia in the 50s and 60s that killed millions of people, but it hardly killed anybody in the United States. Yeah, so every disease that comes along is very different. But what most historians point to is, and public health experts talk about this too, but this is mostly from historians and journalists, is that you have this zoonosis, where most of the horrible pandemics we've had and epidemics can be traced back to an animal spillover. It's usually not just one animal that infects a person. It usually has to, it usually comes from one animal and then transfers to another one, and then it gets closer. That animal is in proximity to a human. So a pig or a chicken, for example, or cattle or a dog, then they'll get this infection, and then people, because we interact with these animals so closely, that we get them. But I think this crossover is important, since we're all in the same ecosystem now. And if I could talk in broader historical terms, that is for the first time in human history, we are in the same ecosystem. That is past 500 years, ever since Columbus arrived here. That goes a long way towards explaining why these infections happen and why they surprise people. Because before that, for a million or so years, humans were in separate hemispheres. Well, all humans were pretty much in the eastern hemisphere. But then once we had farming, and I know I'm getting a little bit too far back into history, but farming came along about 11,000 years ago. At that point, there were humans in both hemispheres, but only the animals, the big animals in particular, like cattle and pigs and sheep and goats and then chickens, which we farm quite a bit too, those were all in the eastern hemisphere. And so those infected people at a really high rate because they were in close proximity to them when they were farming them. And then that's when we start to get these massive epidemics. We have larger population densities precisely because of the farming too. That's a whole other tangent, but I think it's also important to recognize as one of those factors. And so I wanted to bring that into the book too, to provide a little bit of context, because the idea of a lab leak, while not impossible, just historically speaking, we don't have lab leaks that have been documented to have led to pandemics. There have been a couple cases where a few people die, like there was an Ebola case in Virginia a couple decades ago that James Reston wrote about, and I think one person died from that. There was a case in Russia too, back in the 70s, where an influenza spilled out of the lab and killed 9 or 10 people. But when you look at like the plague, malaria, diphtheria, measles, smallpox, all these other ones, yellow fever, etc. Just historically speaking, it's come from animals. So, yeah.
But, what could they have done better or worse in COVID? I mean, you said everybody, when it went fast, everything was shut down right away. But you think it might have been better if they had been a little more patient or a little softer on the regulations, or what do you think of that?
The only thing I can think of is
there any way you really actually know?
Probably not, and that's why I think discussions like conferences, they probably were going on, but it would have been good, I think, if we didn't have all the extra political noise around it. The one thing I can think of is that if we look back in history, quarantine has always been a choice, and they did that with the plague. Quarantine actually is an Italian term that means 40, and so the Italian, when the ships would come in before they came in, they had to stay off the coast for 40 days. Quarantina, and that's the same in Spanish. And so maybe a 40-day lockdown would have been okay in the beginning, but once they saw that it was going to mutate, once they saw that something like a third of all workers in the country were considered essential, and so by saying, well, we can have 50 million workers out there, but we can't have 150 million workers, that's not going to slow any spread.
Right.
And then to say that the kids, because they could contract it and then bring it home to their parents and grandparents, that they therefore can't go to school. As a parent who was dealing with twin 13-year-olds at that time, it was brutal. Yeah, because they had nothing to do and they couldn't see their friends, and they were used to seeing their friends on a daily basis. Mental health problems ensued all over the world. In this latest book, it was talking about millions of kids that are dealing with this. There was a massive spike in anorexia because kids were just, closing in on themselves and they're just sitting in their homes. So I think that was the one thing I would change next time is I think they'd say no matter what, the kids should still go to school, but they should be outside. Let's just keep them outside. So for example, my son, I know this is turning into a longer thing, but I have a good story about that. One of my sons wanted to do football, and the football team at one of the local high schools ended up, they didn't make the kids wear masks while they were practicing. They were outdoors all the time. They brought the weights outside. Literally, kids were lifting weights outside even when it rained. And at one point, the rain just gushed down. There's 100 boys out on the football field, and they all came together. I'll still remember it. It's just a beautiful picture. They all came together, and they were just hugging each other, jumping up and down, screaming at the sky at how happy they were.
Just to be together?
Just to be together, doing something exhilarating, and they felt tough and they felt like young men, and I just thought, well, and guess what? How many of those kids got sick from COVID? None. They didn't get sick at all. Yeah, and this was in May of that year.
Wow, right.
Yeah, right in the beginning. Yeah.
I have a quick question. How much did it hurt when the vaccine got a bad rap? People called it different names. Then people became afraid of it, and there are people who don't believe in vaccines. How much did that hurt? Success rate of being successful, getting through a little more successfully without.
That's a good question. I haven't studied. I've heard that where you had vaccine skepticism, or I've read where you had vaccine skepticism, then you certainly had lower rates of the vaccine. And I think even I read that it could have been associated with or correlated with higher rates of infection. But at the same time, there's all these other factors that are associated with it. So like morbidity, mortality, diabetes, and things like that. So that's another thing. There's a lot of interlocking factors in there. I do think though that it was unfortunate that there was a lot of, I don't even know how much it was information, but certainly skepticism thrown at the idea of the vaccine. That was unfortunate. I'm leaning on the side that it's unfortunate because I do believe that the vaccine worked for the most part. However, I think that they really should have emphasized that listen, you don't have to get this. We're rolling this out as an experiment. We have tested it as much as we possibly can, but we're rolling it out faster with the imprimatur of the president. Now, as a historian, I think in future generations, they're going to put Operation Warp Speed as one of the achievements of the first Trump administration. Because there's never been a case where a government has funded the vaccine rollout so quickly. But I think that it was unfortunate though that people thought that it was supposed to prevent them from getting it or spreading it because they never said that.
That's what Fauci said. He said, if you get the vaccine, you won't get COVID. And then people got COVID. And then he said, if you get the vaccine, you can't spread COVID. And that didn't happen either.
Well, and that's what I have a difference of opinion. I don't know that I can, if I could see where he actually said that, because my memory.
I saw it on TV.
Well,
Yeah.
but that's another thing with history, right? Because sometimes we believe that, not to say that you're misremembering, but unless we actually have the documentation, my memory was that, and I'm not sure about Fauci. I know there's a great podcast, the most well-known podcast on viruses, and it's called This Week in Virology. And it has all these experts from universities around the country. And what they were saying was that the vaccine information does not say that you can't get COVID. It just says that you won't be hospitalized or die from COVID. It said, because it'd be impossible not to contract it, right? You can contract it, but have a mild sense of it. And you could, of course, inhale the germs and then pass it on to somebody else, and no vaccine would ever stop that. If he said that, then if I could see the actual.
Then I'll stop it. Because I have never seen this, and I'm just curious, since you've studied this. Has there ever been a time when an entire population of healthy people has been isolated? Because usually when somebody's sick, they isolate the sick.
Yeah.
We isolate an entire population of healthy people.
We've done that we did that with the Spanish flu, but it was not a nationwide mandate, and it didn't happen universally in every city in the country. And so I think it's a very valid question because we did it indefinitely. They did it indefinitely. They first said it's going to be 2 weeks, and then they extended it, and that's where I think the mistake was. Doing it for those, I think a 40-day quarantine would be okay, though, and say, listen, no matter what, we're doing 40 days so we can study it because you would need that much time. Sometimes people contracted the virus, and then it took a month before they got sick, right? But then after that, if they say, well, because actually in this book, An Abundance of Caution, it shows, it's arguing at least, that in big cities in particular, that the cases were starting to flatten out. And they were saying, we're going to do this until we flatten the curve. And this author's saying, we flattened the curve, so why shouldn't we open up? But we didn't open up. Yeah. And so doing it for months on end, that's never happened. Yeah. I don't think the plague is the is the worst case we've ever had in history because it was a 30% fatality rate, 33% fatality rate, sometimes even higher. Whole towns sometimes died. And in those cases, it was totally uncontrolled. Once they arrived on land, they couldn't do anything at all. Yeah.
The other thing that we learned, Dr. Mopson spoke to our group
Oh,
during
yeah.
COVID, and people didn't trust the vaccine because they said it was too fast, Operation Warp Speed, but they had the base.
Yeah.
They had the foundation for it. They didn't start from scratch. They did great because they're working on a vaccine. I forget what he's, maybe someone remember, I don't remember. But they had the base, then they took that and they just, segued into a vaccine for COVID. But people didn't understand that, and so I think there was misinformation, and they became doubters. Then all of a sudden it was the jab, the stick, and it got a bad name. When in fact, I think it helped.
It was years in advance. Yeah, they already had the mRNA, the exact
Yes,
formula,
yes.
2 weeks after. They had it in February, I think,
Yes,
of the year
yes.
before it was actually rolled out. Yeah.
I'm going back to the plague, the bubonic plague
Yeah.
that we're talking about. Until recently, I had always thought that the plague was a 50-year period sometime in mid 1400s or something. But I've recently discovered that the plague would hit and of course have the huge wipeout a number of times through those centuries.
Centuries. That's right.
But how did we? I know it's not completely gone. It's
No,
in
it
labs
still exists.
somewhere. But how did we, as a group, we're not being killed by it anymore? How did we do that?
Yeah. So part of it is that so it actually came in 3 huge waves and hundreds of minor waves. The first one we know about is the plague of Justinian in the 6th century. It killed tens of millions of people in Europe. Yeah.
There weren't that many people around back then.
Not back then. It was,
Yeah, it was caused by fleas, correct?
yes, but
The berry, yeah.
But the germ
Very
itself, so that's the concept of the reservoir host is something we need to understand too, because there are animals that harbor these germs, viruses and bacteria in their guts and in their saliva. And so we don't know the first ground dwelling rodent that had plague, but it initiates in these ground dwelling rodents. They can find them, for example, if you go to certain national parks, you can actually say, don't feed the ground squirrels, don't feed these animals because they carry plague. And that's in the Western hemisphere, but they originated in Asia, though, actually. And so then the fleas that would bite those animals, then they would bite rats, and rats travel with humans, especially on the Silk Road, right? In Eurasia, they travel with humans, and then they also get on boats and things, because rats aren't afraid of people, so they live in our houses too. And so then the fleas would then jump onto us. The bad thing about the plague, though, too, is it wasn't just from fleas that were infected, but if they would bite you, you could actually cough and then cough it onto somebody else too. There was something called the pneumonic plague, and that was nearly 100% fatal too. So there's all these different degrees of it, but it was all from the same germ, though. It could just manifest itself in 3 different ways. But eventually, though, they found out that it was a bacterium, and then they could actually treat it with antibiotics. But also part of it is that when you have a really fatal plague like that, it comes in waves because it kills so many people that there's not anybody else to spread it anymore. And so, yeah, the people die off very quickly. The plague would kill you in a few days. And then, and people would always flee from them too. So the people that didn't get sick, then they wouldn't get sick. But then all it would take was another flea to bite somebody. And so now recently, whenever anybody does get the plague, they give them a dose of antibiotics, and then it doesn't spread. Yeah. But yeah, I wish I had a better answer for why in the early 1900s, you don't see that much plague anymore. We had some in California and in Asia at that time, but the latest one was mostly in China and India in the late 1800s.
Cleanliness and all played a big part in that, right? Whether you know, were packed in 15 people in a room with rats living with you and whether you weren't, and, you know, because the pneumonic form was not the main, I mean, it was a very fatal form, but it was not the most common form. The bubonic plague was the most common and not most fatal by numbers, but by percentage, but by numbers, it was the most common.
Yeah, and that kind of ties in with the theory about the lower the case fatality rate, the deadlier it can be, because it can kind of work. You know, and some people who would get sick also wouldn't die from it too, right? With septicemic or with pneumonic, you would, whereas with bubonic, not everybody did.
Do they acquire immunity with that? Or could they get it repeatedly?
So it's whenever I don't have direct knowledge of something or if I haven't read it before, then that my answer is always the same, which is I'd love to find that out. Yeah. I don't really know. With bacterial, as far as I know, bacterial infections are harder to acquire an immunity to. I don't know why that is exactly, but I think with viruses though, for some reason you can. Like with smallpox, then you can that kind of immunity. I don't know exactly what the cause is, because we do have bacterial vaccines too, and that provides immunity. So I could be wrong about that. Yeah. Yes.
I wanted to go back to something you said earlier about the robust public health program that West Virginia had in the, you know, early 20th century, 19th. And do you think that came about because there was such an influx of immigrants into coal mining towns, or, I mean, was that where a lot of epidemics came from rather than the more stable agricultural areas in the northern part of the state? Or do you have any information about?
That is certainly possible. I will say, in the case of, I'm just going to move towards the chapter that deals with that. Yeah, so two things on that. With the immigrants that came in, yes, they were certainly likely to bring in germs because the movement in the coal fields and the timber fields too. Yeah, timber as well, and in the railroads. You know, there's all this movement from outside that's coming in. So I would surmise that that's the case, although I haven't seen a study that analyzes it like that. I can think of a couple of examples where they were saying, look, you know, this person's going to be coming in on a train, right?
That's so interesting.
Especially there was a case coming in from Pomeroy. There was a case in Charleston, but then there was a case in Pomeroy too. They're saying, don't let the train come in from Pomeroy because it might have a smallpox infected on it. And then the other thing I can say is that this chapter done by 3 ETSU authors, they're right in this tri-state area between Virginia, Tennessee, and North Carolina, that they were saying that really the coal fields were much more highly infected during the influenza outbreak. The place that had the highest rate of infection was a U.S. Army base up in Chillicothe, Ohio, too. It was something like 3% or 4% of all the troops up there died from Spanish flu. And so, and you think, well, okay, that's not that high of a number, but these are all like 18, 19, 20-year-old men too. Yeah. Yeah, and that you don't hear that happening on bases now. Dr. Muffson, actually, I was going to relate back to that. I interviewed him, and he was talking about how he was involved in making vaccines. So he's such an authority on vaccines because he was involved in making some vaccines at Parris Island Marine Corps Recruit Depot back in the 1950s. That was one of his first jobs that he had. And he was saying how the most recent, because they had to do, it was mainly for pneumonia, I think. Because when you get crowded troops in from all over the country, I was in Marine Corps boot camp 30 years ago, and the most common sound that you hear after a week is coughing. Everybody is coughing, and those germs are just circulating from all over the country. And so he talks about how the most recent pneumonia vaccine that he was involved in making has 13 different strains And these are all bacterial too. So they introduced 13 strains of pneumonia into a person so they can be protected hopefully for the next 20 years.
If it would be beneficial, I could share that program with
Oh, yeah, sure, that'd be great.
The Spanish flu hit West Charleston and eastern Putnam County disproportionately hard because they were building the city of Nitro. And soldiers were coming in from all over. And many of the families were hit. My family lost 2 family members in the space of about 4 weeks from the Spanish flu. And neither of them worked in Nitro, but they were living in West Charleston. And I've read newspaper accounts and other reports about the doctors were overwhelmed, and many of the doctors died trying to treat Spanish flu in West Charleston. And it was a concentration camp.
That's it. Yeah. And I don't know what else they could have done at that time. John Barry has the quintessential book on this. It's like 400 pages long, The Great Influenza. He spends the first quarter of the book talking about, I see some nodding of the heads, that's great. First quarter of the book is looking at the history of medicine in the United States. And he basically talks about, I interviewed him for the podcast too. He said, so they were having difficulty coming up with treatments during the Spanish flu. He said they had no treatments. He said that the medical education in the United States in 1918 was decades behind Europe's even. It took a long time. Johns Hopkins in 1893, that was the first real professional medical school, which is kind of why it's considered one of the gold standards today. And he said basically all they could do was give them, opioids. That's it, and alcohol. And they tried to quarantine. They came up with vaccines too. And this is an example of why people have a reason to be skeptical about vaccines, or at least to ask questions about them. Because the vaccines that the government rolled out back then were based on the pneumonia bacteria that they found in people's lungs, or in their blood, that is. But because what infected them first was the virus, but then the pneumonia was what killed most of them in the end. Yeah, they got a double whammy.
They die of secondary causes.
Which we see all the time
Right.
today, right?
Yeah.
Going to
Still
yeah.
die.
Yeah, that's kind of it.
Right. What's the biggest concern if someone gets intubated? Right.
A lot of them, usually they get intubated because they a lot of
Yeah.
times,
It's a risk, right? The doctors don't want to do it if they don't have to. They do it anyway. Yeah. But I mean, they wouldn't just intubate you. Just yeah.
Say, chill out a little bit, yeah. Give it a minute.
Yeah, the Spanish flu, I think, is a fascinating one. In fact, Robert F. Kennedy Jr. is recorded as saying that that the record shows that it wasn't a virus that was actually killing them, which is true, but he's leaving out that context, which is that the virus is what hit them first and then weakened them to the point where they ended up getting pneumonia, secondary infection.
Soldiers that were in Europe, were they as impacted as soldiers in the United States?
Yes, this is such a fascinating story. The Spanish flu, it really begins, they believe that it begins on a hog farm in Kansas, and that recruits from their draftees were then taken to a huge base in central Kansas, not that far from there. And then that's where the first outbreak happened in March of 1918. A few troops died, a lot of them got sick, it wasn't nearly as virulent for some reason, it evolved. So then the troops then moved east, infecting people at bases all along the way. Then they got on boats and they went over to Europe during the spring and summer, and they fought over there. And then the European troops, they all get infected, but why did it go worldwide? Well, because all those European powers who were fighting had empires. And then they ended up spreading it to their empires. And the bulk of the people who died were in India, China, and Africa. In fact, we had about 700,000 people who died here, but maybe 50 million people died in just Asia alone. Yeah, because of global trade, which is again, that's those networks that were established by the empires, starting with Columbus, and then you have globalization. That's the same kind of networks that we have today, and so the COVID virus just mapped onto those same networks, the trade networks that we have.
Is there any evidence that the flu helped to shorten the war? The reason I ask is my grandfather was a soldier. He was just like he'd just been recruited, was in the United States at a base somewhere, I don't remember where, got the flu. By the time he recovered, the armistice had been signed, so he didn't have to go to Europe. But
That's an interesting question because
you would think that the numbers of young
people who are
men,
weak. It would be like, there's one, a historian named William McNeil talks about mosquitoes as general anopheles. Like basically, they were generals themselves. Right? Anopheles is the mosquito that carries malaria. And so in a way, it's like a force multiplier because you have so many more troops that were sick that they couldn't fight. It might have weakened, in this case, the Germans. That's possible. I bet somebody has done some research on that. I haven't seen it myself. But what we do know is that the back home, it was politically difficult for people to ask everybody to quarantine at the same time in September and October as they were trying to do the war bond drives.
yes,
And so there's these famous cases of St. Louis and Philadelphia. In Philadelphia, they had the parade, and then in St. Louis they didn't, and then they had higher fatality rates in Philadelphia because of that. It's interesting too because all over the country they had different degrees of quarantines. In San Francisco, they had the strictest. In fact, what they said in San Francisco is that if you were caught outside without a mask on, then it was a felony offense. It was as if you were carrying a deadly weapon. We know of one case, at least one case in San Francisco, where a man was told to put his mask on, he refused, and the officer shot him dead.
Oh, God.
Yeah, that's in John Barry's book. Yeah.
Why, if it started in the West, the Midwest of the United States, why did the Spanish get the blame?
Yeah, that must have been
Who
a
knows
big,
the reason?
big political
Who knows why the
thing.
Spanish get the blame? Yeah. Emily.
Because we were fighting the war, we were patriotic, we wanted people to go out and buy war bonds and stuff like that. So the news was censored about how many people were getting the flu and everything. And that was that way all over the world, but Spain didn't have censorship. So they reported all these people were dying. And they weren't in the war.
That's right, they were neutral, and so they didn't have a dog in the fight. We know Wilson, and this is ironic too, we know that Wilson did not want this to be spread. And I think historians have given him a pass on that because we were just slamming the door shut on the Germans, right? We can't have this backslide, right? Because the Germans, we didn't necessarily, it wasn't a fait accompli that we were going to defeat them militarily. And so they just had to push it towards the end. What's the irony about the Wilson thing? Who knows? Anybody know? So you all know that he had a stroke when he was in Europe in 1919 during the Paris peace talks, right? Some historians believe it was because he contracted the Spanish flu that led to the actual the stroke itself.
and also I think this may have been in John Barry's book, that it may have affected the Treaty of Versailles,
Absolutely.
that he kind of gave away too much.
Well, that it's believed that because he wasn't in favor of the extent to which the Germans had to pay reparations, right? The restrictions on them, of course, which historians debate the extent to which those restrictions led to the rise of Adolf Hitler. I mean, it's a total humiliation of the Germans. Did they need to have to pay all these reparations back and not be able to expand their military, what have you? You put them in a tiny box, you know. But those talks were happening during the time that he was sick. Yeah, and so he didn't have the same kind of energy to put into it. Yeah, and he had others that were involved in advising. Yeah, I mean, diseases play such a big role in human history that we can't overlook them.
Guns, germs, and steel, Jared Diamond's book.
Absolutely. Yeah, those three together, yeah, definitely matter.
Bill that had a surgery like on a ship somewhere, like kind of under the radar. He had a tumor or something, it was now,
I know his son had something too. I don't know if it was
I
him.
don't
It
know
might
if
have
it
been.
was Roosevelt, but there was somebody that it was kind of clandestine that he had a procedure done on a ship, on a Navy ship in the middle of nowhere so that nobody knew about it.
Yeah, maybe. Yeah, because that would obviously reduce trust,
Right.
right, or confidence. I guess if I could just kind of.
I just
Right.
Googled that.
Yeah?
And it says, no, Roosevelt did not have a medical procedure on a Navy ship. The question appears to be misunderstanding. We're talking about Franklin Delano Roosevelt. Had a polio diagnosis, he used a specifically adapted elevator, blah, blah, on the Navy ship to access different levels due to his paralysis. But according to this, quickly, he did not have a medical procedure on a Navy ship.
Who was there a president that had a clandestine
Okay.
procedure? No, I read that.
We deal with that.
I know, I love it. President Grover Cleveland had a secret operation to remove a cancerous tumor from his jaw, you're right, while sailing on the steam yacht Oneida, according to historical accounts. It took place in July of 1893, while the yacht was en route to Cleveland's summer home.
Damn, an epidemic.
Close but no cigar, right?
Yeah, it was kept secret from the public for weeks, and it wasn't officially acknowledged until 24 years later. They're all over the place. Here we go.
Well, I was going to focus a little bit on some insect-borne illnesses, only because we don't. Was that?
Because of our current.
We are in a current situation, definitely, and the chapter that we have on Lyme disease, written by a geographer, Corinne Calibras, who teaches at Virginia Tech, and geographers are so important in this. This is why we wanted to get a diverse group of people, because they come at it from so many different angles. I could have never done this. What she did was she's actually mapped the spread of Lyme disease in Appalachia, along with basically, how do you put this, with communities that are building into the forest. And so what ends up happening is that because people want to live out in the countryside, it ends up making it so that the forest is not continuous anymore. And so you have these little enclaves of neighborhoods in the middle of the forest, and so we're encroaching on nature. You have the same problem with all kinds of other diseases too, like HIV, like Ebola, and so many others. Yellow fever, the same thing happens with yellow fever. You'll see an outbreak of yellow fever in Latin America or in Africa, and it oftentimes is because there are people who are working, farmers or loggers are working out in the jungle, and they get bit by mosquitoes who have transferred the germ from a primate onto the people, because the primates harbor these germs. So what happens with the ticks is we think they come from deer, but actually they don't. The deer is part of the life cycle of the tick, but the tick actually acquires the germ, the Lyme disease germ, from initially from a ground-dwelling rodent, a mouse. The white-footed mouse is the main reservoir host. So that means that these hosts are passing, the mother passes it on to the baby, then the mother passes it on to the baby, and so on. They live in their guts. So when the tick feeds on them, then they also hop onto a deer, and because the deer live close to humans when they encroach into nature, that's when you end up getting Lyme disease. So you can get it because you live in the forest, but also because the forests, they are semi-contiguous, even if the habitat is in there, but it's not perfectly contiguous. In other words, it's not separate from us. So when we go into the forest, we're going into a habitat where the Lyme disease cycle is spreading. It depends on the trees because they have acorns and nuts that the mice eat and the chipmunks eat. And the chipmunks also can harbor it. And then they spread it onto the deer, and then the deer give it to us. Or the dogs do. The dog ends up bringing it in, obviously.
What is the one that people get from ticks that it's alpha something
Alpha
where
gal.
they can't eat beef?
Red meat.
Yeah, isn't it the Lone Star one, right?
It's called alpha
Yeah.
gal.
It's
called
not
what?
a, it's
Alpha
not
gal.
an infectious disease, it's an immunological disease.
Oh, okay.
Galactose is a sugar, which most allergies are not to sugars, usually they're to proteins, but it's a sugar that is in most mammals except primates. And we eat it all the time and it's fine, it gets broken down in your gut, that's not an issue. But if it gets injected into you, then you make antibodies toward it, and that's when you get in trouble.
I know a couple people that have that.
Do you want the definition of it? It is a tick-borne food allergy where individuals become allergic to red meat due to a sugar molecule called galactose. The allergy is triggered by a Lone Star tick bite, which can inject alpha-gal molecules into the bloodstream, causing the body to produce antibodies against it.
Yeah, and they're all different. That's the crazy thing about this, is there are no two diseases that are alike, but we try to treat them mean, it's really difficult. Public health experts have to figure out what this thing is. They gotta figure out the etiology, then they gotta figure out the transmission, they got how long it is. I think that's one thing that we have to understand too, is that we were all kind of looking to the public health experts. And then when they came up with these diagnoses, then if we didn't like them, then it's like, well, then you come up with something different, right? But I think they tended to be the most knowledgeable people, and of course, people are fallible. Just like a general that makes a mistake, he could have tons of experience, and look at MacArthur, right? Made some big mistakes when it came to Korea. Malaria is another interesting one too. I wanted to point out the Tennessee Valley Authority tried to come in and tell farmers that they needed to dam up the river so that they could become more modernized. They used this type of imagery, right, to try and portray people in Appalachia. You can't really see it too well, but basically they're trying to portray them as needing, like they were backwards, and then they needed to become more sophisticated. And so they would bring hydroelectricity, then they'd be, the controlled farms, and they didn't have problems with malaria. But what happens when you dam up a river? Well, you create artificial conditions where the people themselves are not used to. And so the biggest problem with mosquitoes is when you create stagnant water. And so if you change the control of the water, then you will create, not always, but you can create puddles of water just in little divots in the ground that weren't there before. And that's what the mosquitoes want. They need to have stagnant water with a little bit of nutrients in the dirt there to feed their larvae that turn in their eggs and turn to larvae that turn into full-grown adults, and then they spread the malaria. So what ends up happening when they dammed it was that they actually end up creating the conditions for malaria. Yeah. And so the people themselves, they hadn't been infected by malaria before, then they got infected by it. Yeah. And so then they had to turn around and come up with fumigation. Yeah, then they had to fumigate the rivers afterwards. Yeah, you bring modernization, but it ends up bringing all these kinds of problems. There's something similar to that with Mississippi River too, right? Yeah, when they try to control it.
We're reading Barry's book on the rising tide.
Excellent book.
And we're just starting. He's such a good writer.
Oh my gosh, it's great. It's a really good book.
Lots of other examples here. I don't want to worry all too long. I can end on this one with the polio crusade. Here's an interesting. This is a very interesting chapter. If you ever go to Wytheville, Virginia, I'm sure most of you have driven through it before, right? It's on the way. But there is a fascinating little museum there, and the museum actually has it has two iron lungs. It's got one for an adult, and it's got one for a baby too, that are on display from that time. Because in 1950, in the summer of 1950, Wytheville, Virginia had the highest case fatality rate in the country. In fact, the polio crusade, American Experience did a polio crusade episode, and they start off with the case of Wytheville, Virginia. They call it the summer with no, what was it? Summer of no kids, something like that, because the kids couldn't go to the pools. They were unsure, what spread the disease in 1950. A lot of people were, at least scientists knew. It was fecal up to oral. But this is one of those signs here because it's a major tourist destination too. And they talked about being careful about polio. Something like like several hundred people ended up getting it. It was awful. But the strange thing about polio though is the polio crusade was based in part on the belief, not the knowledge, not the 100% knowledge that FDR had polio. You ever heard this before? It's not entirely certain that actually what crippled him was polio. And that's what they believed at the time, but he contracted it. If you look at him when he was younger, that most of the time people who get polio, they're younger. It's not impossible for someone who's older to contract it, but most of the time it's for younger people. He was like in his, I can't remember, 20s or 30s, right? And there is speculation that something else happened to him, but I won't say. But in any case, though, that's almost irrelevant. It's just one of those questions of history because we don't necessarily always know what somebody has contracted. You can be crippled by other things too. So then it turned into the March of Dimes, this crusade, and then it became the most important one. But actually, of all the diseases in the country that were killing people, polio was way down on the list. It just became the most scary. In part because obviously kids were being crippled by it, right? The fatality rate was much lower though. Infection rates were very low too. It was something like 1% of people who ended up being exposed to it ended up actually having any complications. And it wasn't as widespread either. It just terrified people, in part because of what happened to kids, but also because of the March of Dimes. There's a great book written by Daniel Oshinsky out of New York University. And he really talks about the ins and outs of it was a propaganda campaign. It sounds crass to say that, right? Because certainly kids were being infected by it, but he emphasizes how people thought of polio as the most dangerous thing, in part because it was advertised as such. Yeah, because they wanted to have some type of a success, and it was connected to the president
There's a
too.
very big motivator.
Well, when you think about it, television came about right about that same time period. Because
They're
I
always-
feel like I remember.
They're always showing that iron lung.
Yeah, and the March of Dimes.
magazines,
and-
I
I remember that.
I went through that,
Yeah.
you know.
Yeah, but things like tuberculosis and pneumonia and things like that were killing people at a much higher rate too.
Yeah, but you did, just definitely the campaign, the March of Dimes campaign. I mean, I was born in '56, but I still remember, a lot of emphasis on getting our little card where you put your dimes in. That was a big
Yeah.
thing.
Yeah.
Yeah, it was a nationalistic cause, right?
Yes.
And so it's probably in the end, a very positive thing. It accelerated Jonas Salk and Albert Sabin ended
They
up.
still send me a dime.
What's that?
They still send me a dime.
Oh, yeah.
Of course, I got returned more at a time, but they're still very active.
Huntington had the children's hospital down where River Park Hospital is now. It's a psychiatric. It was the orthopedic hospital.
And cafeteria.
A lot of children who were in there were responding. We would have to go from, my Sunday school class would have to go there once or twice a year. And it was rather horrific.
Well, that reminds me too, the front cover.
Yes.
We went to the special collections here in the Morrill Library, Kevin and I did, and we wanted to find a good front cover that was local. And so we got this one, which is actually from the Polio Crusade in Huntington from 1957, actually. Yeah. And they had a few other photos too of these same people. It shows this one. This seemed like the best for the front cover.
Well, I feel like I remember seeing an iron lung down at the hospital, but I don't know if I did, if I just, But that was, and yes, you're right, Joe. I think Morris Memorial in Milton
Yeah,
Or
it was
Cologne.
also,
One, yeah.
may have been.
The one that they turned into a resort.
Yes.
yeah, yeah.
And of course, we've had one disease that's actually been eradicated from vaccine entirely. Smallpox.
Smallpox.
Yeah.
Of course, we've all benefited from that.
Yeah, we all have the
Oh, yeah.
Little scar.
That was one of the biggest killers. I think killed 300 million people in the 20th century alone. That was the century that most amount of people died from it. Of course, the population of the world was much bigger in the 20th century too. 300 million, yeah. And there were 200,000 people dying a year in India in the 1960s and 70s from it. So India became ground zero for the zero smallpox campaign led by the World Health Organization. And zero smallpox. And so the last case was October 26, 1979. That's their symbol right there. Questions? Thank you all very much for having me.
Thank you
Yeah.
so much.
Really great presentation. I know it would, but thank you. I think I love the conversation, and we learned so much from our presenter, and then other people chime in, and we learned little snippets of other things. Who knew? Thank you. This is so relevant.
Where is your book available? You said through the UK press or?
Yeah, you can get it on Amazon too.
Oh, okay.
It's definitely available on Amazon.
Okay,
Yeah.
great.
Yeah, it might be cheaper that way than through.
Okay.
You can get it faster than.
Do they have it down in our bookstore?
I don't know.
At the Marshall bookstore?
They might.
Sometimes they have the, university professors get the books.
I know
Stop.
they did have some copies over at book tenders in Barbersville also. Yeah. It came out, I think, in December. Yeah, this past year.
Did you say they have it in Barbersville?
The last time I checked, the book tenders, bookstore
That's where I
did,
live, we'll
yeah.
check.
But that was in February. I gave a book talk there in February, and they had, maybe half a dozen copies there at the time. I'm sure no one's bought any since then.
Well, thank you again. It's been a great turnout.
Thank you,
and
sir.
Thank you all.